Welcome to the Naturally Healthy Pets Podcast. Let's get to it.
Hello and welcome to the Naturally Healthy Pets Podcast. I'm your host, Dr. Judy Morgan, and my guest today is Pam Roussell. We've done a lot of work together and always have a good time, and I love the work that she does. So welcome, Pam. Thank you for agreeing to be my guest.
Oh, anything for you, Judy. I love working with you.
We always have fun. Even when technology gets in the way, but we still have fun.
Yes, we do.
For those of you who do not know Pam, she is a passionate cat lover, energy healing practitioner, and founder and CEO of Purrrfectly Holistic. I love it. She loves educating and empowering cat parents in using a more holistic approach to their cat's health and well-being. But what we're talking about today is not just for cats. This is for dogs as well. So all of you pet parents, I don't care if you have hamsters, gerbils, horses, this all is going to apply. She's a master at muscle testing, and we do a lot of stuff together with muscle testing, and she's so good at it, and I'm so bad at it. Her work centers around energy, frequency, vibration, and intuition to help bring transformation and healing on all levels. And so what we want to talk about today is the missing piece of holistic pet wellness, because Pam is very much ingrained in the holistic sphere, and everything that she promotes for our kitty cats and everyone else all revolves around trying to do things as naturally as possible. And here at Naturally Healthy Pets, we're kind of all about that.
Yes, you are. On a big scale, which is awesome.
So the first thing we want to talk about, the word holistic, because it gets bandied around like, it gets used so many different ways. So what do you consider holistic to be?
Holistic is really looking at the big picture. It's looking at the whole pet. It's looking at the emotional components, the physical components, and the spiritual components of wellness, because it's like three sides of a triangle. They all interact. They all affect each other. And a lot of times when people say holistic, they really don't understand what that means, in my opinion. I think they think of, a natural product, and they really focus more on the physical side. Don't you agree?
Mm-hmm. Absolutely. It's so, I was just talking to somebody about this with my diets in my yin and yang cookbook. Like somebody says, oh, my dog has heart failure. Well, look, here's a diet. The name of it is, heart support or heart draining. Okay, I need that. And they don't go past that, and they get really stuck on, okay, I'm just treating the heart. And, it works, but that's not what we're doing. We need to look at the whole picture.
Right.
So diet is one component of that. But particularly from a traditional veterinary standpoint, two sides of that triangle rarely get looked at, rarely get talked about. So, and, unfortunately, we tend to hone in on heart disease. When, I hate the word disease, but, it's like, and kidney failure. Okay, great. Well, we just sentenced that pet to failure. Like, I think we need a better description. But we also need to look at everything else, because, the kidneys don't work alone. Kidneys are not out walking around doing their own thing without a bunch of other parts and pieces.
Absolutely. I think so many times doctors forget that the body is synergistic. It's not separate little islands. It's very much tied into Chinese medicine, and those people are brilliant. As you know, they've been doing it for thousands of years with success.
Yep.
So they connect every part of the body. They look at emotions. They look at spiritual side. They look at energy fields. They look at meridians. They look at chakra centers. They look at how one area, if there's stagnation or a lack of energy or chi or flow, it impacts the entire body, not just that one organ or gland or system, right?
Exactly.
And so you have to step back. And I think that's what's missed a lot of times, is that people, they zero in and they become very myopic on one little thing. Like you said, it's the heart disease, it's the heart muscle, it's the kidney, it's the bladder, it's whatever that little spot in the body is. It's like, well, how is that affecting everything else? And how is it impacting the overall picture of this wellness or lack of wellness or dis-ease in the body on an emotional, physical, spiritual level? I think that's missed.
Absolutely. Absolutely. It's really interesting because Michelle Allen, who owns Monkey's
Yeah.
House Senior Dog Hospice and Sanctuary, her route for all of these dogs for healing or health or palliative care
Mm-hmm.
is food. So we fix the diet first, because if we
Mm-hmm.
don't have good digestion, we don't have good nutrition, we're not going to be able to solve anything else.
Yep.
But she considers the emotional and spiritual well-being of those dogs just as
Mm-hmm.
important. And so they bought a bus. It used to be a senior citizens bus, and they retrofitted it for the dogs.
Ah.
And they take field trips with all these hospice dogs, sometimes 30 dogs at a time. They go to the beach. They
Ah.
go to the woods. They
Mm-hmm.
go get their pictures taken with Santa at Christmas. They go on field trips with the dogs. Now, a lot of people would say this is not worth the investment of a bus. And, why spend all this time, energy, work to
Mm-hmm.
load up 30 dogs? They also use it to take 20 dogs at a time to PT, um, but why go through all of that and have to have 20 volunteers come along to do these things? It's so important to the emotional well-being
Mm-hmm.
of these dogs.
Mm-hmm.
And those who can't walk go in wagons or carriers or backpacks or strollers. It's just really critical.
Mm-hmm.
It's it's just so left out. Like
Mm-hmm.
taking my dogs on a safari around
Mm-hmm.
the farm outside of their normal area on the farm is like the coolest thing for them. They're just,
Oh yeah.
and sometimes they're at the door telling me, today is a safari day. You better get your ducks in a row. Let's go.
Mm-hmm.
So,
Yes.
but
Emotion.
yeah, it's left out.
There's always an emotional component to illness.
Yeah.
And so if we can address those and put just as much focus on their emotional and spiritual well-being, it impacts their physical well-being. And you can see tremendous changes. I mean, they've done studies. This is not just something we make up, but there's actually proof. I mean, it works. It just makes such a huge difference.
Yeah,
You know.
it absolutely does. So in the show notes, you mention Rockefeller-based medical model.
Mm.
What is that?
Well, a very long time ago, early 1900s, John D. Rockefeller, who was an oil tycoon millionaire at the time, decided he wanted he wanted to use his petroleum products to create pharmaceutical drugs. And he basically, long story short, wanted to weed out all of the natural healers, herbalists, homeopathy practitioners, chiropractors, anybody who did anything natural. He basically created a culture in the industry that made them look like quacks or denigrated their craft, their trades, and even influenced the medical schools with taking money away and saying, if you don't teach our curriculum with the pharmaceutical side, you're not going to get funded. And so a lot of schools had to close, unfortunately, and a lot of them caved, and they acquiesced to the demands because they wanted to keep their doors open. So when that kind of influence was accepted, you lost a huge piece of healing that had been used for hundreds, if not thousands of years, passed down through centuries, generations of information, some of it just lost. But fortunately, there was a segment of those trades that kept going. God bless them, don't know how, but they did, and
Well, it's very similar to what we have in veterinary medicine.
mm-hmm.
Veterinary medicine, with all the corporatization
Mm-hmm.
and
Oh, yeah.
big influence by big pet food, big pharma.
Yep.
And so again, those of us who are swimming upstream on the holistic side saying, wait a minute, guys,
Mm-hmm.
like, I don't want to throw more chemicals at this. I want to ask the body to actually heal.
Yeah.
And I want to look at all the components in this, not just how can I throw a pill at it.
Right.
And it's interesting. Have you read the book about the Kellogg brothers?
No, it sounds interesting.
So it's all about the Rockefeller medicine, because the Kellogg's, the people who made the cereal company, one of them made this healing oasis hospital, and the two brothers totally diverged. One was totally on the Rockefeller side and one is totally on the other side. Really fascinating book.
Wow.
So I would highly recommend it, and I don't have the title off the top of my head, but it so that's the only time I had ever heard about this Rockefeller medicine. And so I think it's, it literally sent us down a totally different path. And when I went to China to study acupuncture back in 2008, we learned that in China, people have a choice. They can either have traditional Chinese medicine and traditional Chinese medicine hospital care, or they can go with Western medicine and Western medicine hospitals. So they have two totally different medical systems, and you choose which one you want to go to.
Wow.
Yeah, really interesting.
Wow. That's so needed.
Yes. So when we have a pet that's sick or something's out of balance, what's the most important question to ask?
It's why. Why never gets asked almost. It like, I know you see it all the time, but like in social media or these private groups or whatever, they're just like, I have a cat that has X problem. What do I use? And I'm just thinking, whoa, peel back some layers here. We need more context. You need to be asking, why is this problem? Why is it even here? And
why is my cat peeing out of the
box? Yes.
Not, I need a pill for this.
Right. Right.
Is it emotional? Is it physical? Is it like,
yeah.
Why?
Why does my cat have diarrhea? Why is my dog vomiting? It's like, don't just try to reach for a bottle or a food or a product. Go, that's fine, but you need to step back and go, okay, why is this happening? And I'll share with you a really cool story. A friend of mine, who was a holistic integrative veterinarian, was working a shift, and these people brought a dog in. The dog hadn't eaten for days and was just lethargic and had no energy. And, everyone was like, all the doctors were immediately like, oh, we need to go into diagnostic mode. We need to take this x-ray. We need to do this with this. And she was like, well, whoa. She talked to the person who brought the dog in. She was like, tell me what's going on. Like, how long has this been going on? What's been happening? And it turns out the dog watched his owner have a heart attack in the kitchen and die 4 days earlier.
Oh, okay.
When you put it into context, well, of course the dog is not eating. He's in shock. He's grieving. He's lost his best friend. And then, so that's a great example of, this is not the time and place to just go try to throw a bunch of medicine and do diagnostics. We need to step back and look at the big picture. And so when I'm talking to clients and doing energy clearing and healing work on them, I want to go deep, and I'll say, start at the very, very, very beginning. Like, when did you get this pet? How long has this been going on? When did you first start noticing something off? And what happened right before that? Can you remember anything that was going on? Was there a trauma? Was it exposed to, in a shelter? Did it potentially get a virus like herpes or whatever? Was it vaccinated?
Right.
Was it just dewormed? And all of a sudden you start seeing all these gut issues. Let's peel back and go way back to the beginning, because I think that's where the answers are. But we get so distracted through time passing that we become very myopic, and it becomes, now there's diarrhea, or, there's GI upset. There's reflux. And we don't step back and go, well, wonder why that is, that's me. Yeah. I'm the inquisitive one. I'm always the one in the back going, excuse me, why do you think that's happening? And I want people to start shifting the way they think, because when you can start asking the why, then the what makes a difference,
Well, and then it can be a lot easier to solve. We need to take a break to hear from our sponsors. We'll be right back. Please stay tuned.
I hope you're enjoying this interview with Pam Roussell as much as I am. She has so much more information to share. Do you know that pets often experience physical and emotional challenges that can be difficult to treat with traditional methods? Color therapy might help. Color therapy uses the vibrational energy of colors to help pets with physical, emotional, mental, and spiritual issues. Naturally Healthy Pets knows that there is limited awareness of understanding color therapy, and that's why we carry Pam Roussell's color therapy course. The goal is to empower pet owners with a natural alternative to balance your pet's energy, promote healing, reduce separation anxiety, and stimulate the nervous system. Why not consider trying color therapy the next time your pet is going through some kind of challenge, either physical or emotional? Use code PODCAST49 for 15% off at drjudyu.com. Are you familiar with muscle testing? Muscle testing is a tool used to gather information by tapping into the nervous system in order to communicate with the body, similar to biofeedback. Naturally Healthy Pets is proud to offer Pam Roussell's 1-hour muscle testing mini course, where Pam teaches several muscle testing techniques you can use on your pet at home as a way of evaluating imbalances in the body and assessing its needs. It provides information on energetic blockages, organ stress, nutritional deficiencies, food sensitivities, and more. Order today at drjudyu.com and use code PODCAST49 for 15% off.
Welcome back. You're listening to Naturally Healthy Pets podcast. I'm your host, Dr. Judy Morgan, and my guest today is Pam Roussell. And we're talking about taking a holistic approach to care. And, it's really interesting. I get consultations with people where, oh, my pet keeps having recurring bloody vomiting and diarrhea. And it happens about every 6 weeks or, and now it's twice a week or whatever. And, sometimes the questions that I ask may not make sense to people, but what you discover is that a lot of times there's a stressor or some sort of event that is occurring. So I had a patient who was a standard poodle, and that dog had a seizure problem. The dog didn't have seizures at home. Every time they took it to the groomer, as soon as it hit the doorstep, it would lay down and have a seizure.
Wow.
Every time they came to my office, hit the doorstep, lay down and have a seizure. This dog could not handle the stressful events.
Yes.
And so it was really easy to put it together because it's like, okay, every time this dog has to do something stressful, there's a seizure. Like its brain just needs to be rewired.
Yeah.
So then you can look at that and say, okay, well, what can we do to decrease the dog's stress level when it's going to have to go through these events? Like, sometimes it's not even a physical issue. It's an emotional issue that they just can't keep it together. And so, when you start seeing a lot of those kinds of cases, or yes, every time we have a party or we have people over, my dog is trembling and hiding in the corner. And then 2 days later, we have bloody diarrhea.
Yeah.
Okay, well, that's a trigger. Now we know a trigger. So if you have an animal who has these sort of chronic problems, and that, it may show up a few days later. I talked to somebody the other day, and their dog was doing great on the home cooked diet for months and months and months. And then it had a just really bad 24 hours, vomiting, diarrhea, just everything a mess. And when I looked at the records, I was like, well, the week before, the dog was at the veterinary office to get blood drawn and have an exam and have all this stuff done. And so then, a week later, when it has this really bad vomiting and diarrhea and has to go back to the veterinary office, what does it get? A hydrolyzed diet, a whole bunch of medications. And now the owner is afraid to go back to the great diet that did so great for that animal for so long, because we had this one incident. And it's like, well, again, like you said, why? Why did it have that incident? What was the root cause?
Yeah.
And certainly, we can get long-term imbalances, but these emotional stress, there's a great study that I read that showed over 80% of indoor house cats are very highly emotionally stressed.
They're bored.
It's not their natural environment.
No.
They need those climbing spaces, and they need entertainment, and there's
mental stimulation.
Look, he's sleeping on the back of the sofa and he hasn't moved in 5 days.
Yeah, they have no mental stimulation. They have no environmental enrichment. So They get very,
Exactly.
very bored. And I think in the case that you were talking about with dogs who get very, very overworked like that, there could be some trauma from their past, and putting them in situations like that is a trigger, and
Yeah.
it signals all those molecules in the brain that just kind of overload, and they just can't handle it, right? And that's the beautiful thing, where energy work can come in and help, and muscle testing can help figure out, and rule in, was it the food? Was it not the food? Was it this? Was it that? It's so fascinating when you can utilize all of these other modalities and pull in other team members, like, get you an animal communicator on your team, get an integrative vet that works with your conventional vet, find a Reiki master that can do some work, find someone like me who does muscle testing that can help rule things in, rule things out, and help you work together with, your other practitioners and your doctors, so that you can build an overall healthy, vibrant pet. And you hit all of these angles, the emotional, the spiritual, and the physical, because that's when you have real, true wellness. When you can get those
Yeah.
all in balance, it's awesome.
Yep. Yeah. And we just get so stuck on, we have kidney failure. We, look at the kidney, look at the kidney, look at the kidney.
Yeah.
And it's like, there's a lot more that goes into this.
Yeah.
And it's so true. Do you do something called the emotion code?
No, but I've looked at it.
My sister does it.
Mm-hmm.
So it's a distance thing,
Yep.
but it literally is peeling back the layers
Mm-hmm.
of the onion to try to, get to that underlying trauma.
Yeah.
And we all have past traumas.
We do.
It's really, and so our pets do too. And we kind of don't think about it. And a lot of us don't know what those past traumas are, particularly if we're doing rescue work.
Mm-hmm.
And we don't necessarily know. And that's where I love working with communicators. I think it is so cool, the things that you can learn from your animals.
Oh, absolutely.
So cool.
Yeah. In the mind, body, spirit release work that I do, I can actually go uncover past events, past traumatic events. And especially with like a lot of these pets who were rescued and we don't know their backstory, and maybe something happened to them when they were, maybe something happened to their mom when they were newborns, and all of a sudden they're on their own and they're helpless and there's no mama, and that's a very traumatic experience for a brand new puppy
Sure.
or kitten or whatever. Or if there's a wild animal that attacks them, or if they're hit by a car because they're on the street, and someone, good Samaritan, comes and finds this poor animal and takes it to a rescue center or whatever. They don't really know the history. But the cool thing about using like the energy modalities, that stuff, and not just the stuff that I do, but other people, is you can uncover all those emotions and you can release those traumas. And then that it's like a weight just gets lifted off of you, off of the pet, because we can do this kind of stuff for humans, obviously. And you don't carry that kind of cellular memory anymore. And it's no longer impeding the wellness and the balance of the energy and your emotions and all of, the spiritual aspect of you that makes you, or your pet. It's fascinating. It really, really is. And so, if you could do something like that, instead of just reaching for a gabapentin or reaching for the, whatever drug of the day that is supposed to calm and whatever, Prozac, it's like, why don't we explore some other options and figure out what's contributing to those kinds of behaviors instead of just throwing a drug at it. That's my.
Can we talk about, I want to talk about vibration.
Yeah.
And I want to talk about how I want you to talk about how the owner's vibration level, the owner's emotion, how does that affect our pets?
Oh my gosh. Well, our pets are little energy sponges. And so they're in our homes, they're around us. And because everything is energy and we give off energy, we are emitting energy on whether it's a low vibe or high vibe or whatever it is. We're putting that into our environment, and it's in the field, and our pets pick up on all of those frequencies, because that's all it is energy is frequency. So if we are super high strung and stressed and like worry all the time, and all we talk about is, oh, I've got this problem and I've got this problem and I've got it, it's all about your ailments. It's all about the people that you don't like. It's all the negative energy, whatever that is, right? Our pets are bombarded with all of these frequencies and energies, and they are going to be impacted, whether it's physically, you start to see physical symptoms of anxiety and behavior problems or vomiting or just being very withdrawn and very scared. They're going to respond. And it's fascinating because when we change the frequency, when we change our energy and our vibration, we see a change in our pets because they're in our field,
Exactly.
and it makes
Exactly.
such a difference. And I just think that people aren't aware,
Yeah. Well, and we have helicopter moms,
Yes.
pet parents, and mom
Yeah.
parents for kids. But some of my consultations that I have done in the past, the owner is so worried about the pet, and so like they're dragging them from doctor to doctor. They're consulting with everybody they can find, and they're switching from one supplement to the next, and the diet, and this and that and the other thing. And I'm like, could we just take a step back and maybe again change how you're approaching this? And I mean, I get that you're worried about your pet, but you're actually making it worse. Like they can't heal in this environment of frenetic worry, constant weepiness, constant,
Yeah.
and it's something when we do get a bad diagnosis with our pets, it's hard not to go into that immediate grief
Yes.
mode. You have to go through all those stages of grief with denial and anger and blah, 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 blah. And, for some people, it's like you've already got them in the grave.
Yeah.
And there's so much that we can do, but we have to fix. Like, you can't be all weepy. Like when my animals are diagnosed with something awful, it's like, okay, well, if I'm going to cry, I'm going to go somewhere else and do that. And then I'm going to come back and I'm going to be all happy. And like, we're going to go do something fun.
Yeah.
So, and the same for people around you that, they got a bad diagnosis or whatever. It's like, okay, good. How about we, not spend 100% of our time focused on.
Well, yeah.
Bad.
Because here's the other half of that, and most people don't realize this, is whatever energy you are putting out, you are attracting the same. So if you are worry, and always talking about your fear and, oh my gosh, I need to get another medication. Well, that's like putting out a little message into the universe that says, I need more worry and I need more fear and I need more medication. And so guess what? That's exactly what you're going to keep getting. So we have to change. Yes. We have to be aware, number one, that we're thinking that way and behaving that way so that we can stop ourselves and go, okay, I need to make a 180 change of what I say and how I'm thinking. And if we can word it in the opposite, and even if you don't believe it yet, you have to start teaching yourself to think positively, think optimistically. Instead of saying my dog has cancer, my dog is healed of cancer. You have to flip that switch, and it is amazing because and it may take a lot of practice, but it's like the expression, if you read something over, if you tell yourself a lie enough times, you'll start to believe it's true. So, and that's the truth. I mean, there's studies about that too. Yep. Just look at mainstream media,
exactly.
So if we can just teach our brain to think differently, to speak differently, to speak with power, to speak with optimism and positivity and health and vibration and, just the opposite. My dog is happy. He is healthy. He is calm. He is relaxed. And you keep putting that energy and you keep telling your dog or your cat every single day that is what you are. And that is your expectation. Then eventually that is what you attract. And I love that so much.
Absolutely. So we're out of time, and we didn't even get to talk about your muscle testing very much, but it's very cool. And for our supporters and private community, Pam does private events for us where she muscle tests supplements that people have questions about for their pets. So very, very cool. It's a nice little perk. So do you have a muscle testing course? Do you teach people to do
I
that?
do. I've actually developed a private mentorship program. It's called Mastering Muscle Testing for Healthy, Happy Pets. So I help dog parents or cat parents learn the art and like master these skills on a level that they have probably never dreamed that they could do this. And it
Very cool.
includes energy healing work as well. So they can basically become their pet's best energy practitioner, healer, working alongside your favorite vets and integrative practitioners, and just, be an important, vibrant part of that team. And just take
Yes.
things into your own hands, because not everybody has a wonderful holistic integrative vet in their neighborhood, so you have to learn how to
Exactly.
do a lot of things. That's why you do all your education. And so it just
Exactly.
empowers us. It gives us more skills,
Absolutely.
gives us more tools.
Absolutely.
So yes.
So we will put links in the show notes, but it's Purrrfectly with 3 R's, holistic.com. And if you've never seen muscle testing, I think on Dr. Judy U, we have like a 1-hour muscle testing
It's like
thing with Pam. So that would be a little intro if you think you might be interested in something like that. And then her masterclass would be amazing, because you could be not only can you use it on your pets, you can use it on yourself. So if you're like, does this food agree with me? You can muscle test it. Do I need this medication? You can muscle test it. So very, very cool stuff. She's really good at it. Like I said, I'm not so good at it. I can do it a little bit. And it's just because I don't practice. So everybody check out Pam. Pam, thank you so much for your time today. We really appreciate you. We love working with you.
I love working with you. And thanks everyone for joining us.
Thanks for listening to another great Naturally Healthy Pets episode. Be sure to check out the show notes for some helpful links. And if you enjoy the show, please be sure to follow and listen for free on your favorite podcast app. We value your feedback and would love to hear from you on how we're doing. Visit drjudymorgan.com for healthy product recommendations, comprehensive courses, upcoming events, and other fantastic resources. Until next time, keep giving your pet the vibrant life they deserve.
The purpose of this podcast is to educate and to inform. It is no substitute for professional care by a veterinarian, licensed nutritionist, or other qualified professional. You're encouraged to do your own research and should not rely on this information as professional medical advice, diagnosis, or treatment. Dr. Judy and her guests express their own views, experience, and conclusions. Dr. Judy Morgan's Naturally Healthy Pets neither endorses or opposes any particular view discussed here.